everybody, welcome to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing an anti-psychotic medication, more specifically a second-generation anti-psychotic known as Quetiapine. Its brand name is Seroquel. But before we get started, just keep in mind that this channel is for information purposes only and not to be used as a source of recommendations for your personal health care. This medication is commonly seen in schizophrenia as well as bipolar disorder. In schizophrenia, it can be used for the treatment in the acute phase as well as maintenance therapy. And in bipolar, we can see it used to treat mania as well as depressive episodes. Although mixed episodes in bipolar are rare, it is used in this situation as well. After a patient gets back to level following a manic episode or a depressed episode, this medication can stay on board for maintenance therapy for bipolar as well. You do see it occasionally used in delirium, and there are some case reports and case studies that suggest it could be used in dementia as well. It can also be used to treat depression not associated with bipolar, as well as certain movement disorders such as tardive dyskinesias. We sometimes see it used to help treat anorexia nervosa, as well as borderline personality disorder, and some addictive behaviors. And finally, we do see it used to help treat obsessive compulsive disorder, as well as a tic disorder. It's tough to discuss the pharmacology of this medication specifically without talking more broadly about second-generation antipsychotics in general. However, the main 3 points that separate second-generation antipsychotics from first-generation antipsychotics are 1. The greater affinity for 5-HT2A receptors as well as D2 blockade. They have a faster dissociation from the D2 receptor. And finally, they have a potential for greater affinity for the mesolimbic tract. Now, typically, before I start talking more specifically about the medication, I talk about contraindications to the medication that the patient must clear. For this medication, there aren't really many contraindications aside from the fact that you can't use the medication if you have a proven hypersensitivity to any component of the medication itself. With this medication, it's more important to talk about precautions and warnings. So this medication can cause some trouble in terms of regulating body temperature. This antipsychotic has an ability to make it more difficult to bring your core temperature down. There can be some acute withdrawal symptoms of this medication as well after discontinuation. This would typically present as nausea, insomnia, headache, diarrhea, dizziness, potentially some vomiting. For this reason, it's usually advised to decrease the dose of the medication over a course of 1 to 2 weeks when stopping it. Seroquel or Quetiapine does have the ability to cause orthostatic hypotension, so this is something that would have to be considered in patients that have cardiovascular disease. If this was to occur, it usually occurs in the first couple weeks of therapy. Studies have shown that people who use Quetiapine can see an elevation in their cholesterol and triglycerides by 11 and 17% respectively. This next point, which is more important for people who have diabetes, but important for everybody nonetheless, is that this medication can cause hyperglycemia or a raise in blood sugar. It can cause a decrease in thyroxine levels in the blood. This would be for both total amount as well as free amount, so T4. People should be made aware that they can experience some weight gain potentially from Seroquel. And tardive dyskinesias can occur as well as extrapyramidal symptoms, which we'll discuss when we talk about adverse reactions. So once somebody's made aware of all the precautions and they start using the medication, they can expect to be taking it in tablet form, and the tablet will usually range in strength anywhere from 25 milligrams to 400 milligrams. The extended release version ranges from 50 milligrams to 400. One thing that should be noted here about the tablets of Quetiapine is that they can occasionally contain lactose, so it's important to have your pharmacist check the label if you were to be lactose intolerant. When treating psychosis, this medication is typically started off at a dose of 25 milligrams taken twice daily. Each day, this would be increased by 25 to 50 milligrams taken twice daily, with the goal of reaching 300 milligrams twice a day within 4 to 7 days. So the usual daily dose would be 300 to 600 milligrams with a maximum daily dose of 800 milligrams. The maximum daily dose for the extended release version is the same, but the dosing itself would be different. After taking a dose, the peak plasma concentration levels occur between a half an hour and 3 hours. The parent medication has a 6 to 7 hour half-life, and the active metabolite has a 12-hour half-life. These numbers could be extended by 45% in those who have hepatic disease or liver disease. The dosing would be more specific for the other indications mentioned at the start of the video, but they're not too common, so we're not going to go over the dosing for those, and we'll just keep it at the antipsychotic dosing. It does take some time to find maximum benefit with this medication, especially since we do have to titrate the medication up to the recommended daily dose, and the dose that people use for maintenance therapy will differ from individual to individual. So while using this medication, there are some adverse reactions or side effects that people may experience, so I'll list some of them here for you now. 7% of people experience fatigue, and an even lesser amount experience irritability. The drug monograph classifies sedation different from fatigue, and this comes in at 18%. 22% of people experience somnolence, and 14% can experience dizziness. Dry mouth is common with this medication. It comes in at 29%. Constipation and upset stomach come in at about 5%. And these following side effects are all under 4%. Heart palpitations, rapid heart rate, an increase in weight, an increase in appetite, joint pain, nasal congestion, and a potential cough. Some people also experience blurred vision. One very rare side effect that could occur with quetiapine or Seroquel is priapism. That's all we're going to talk about today with Seroquel. As always, I'm thankful you took the time to stop by and watch one of my videos. If you find this information to be valuable and you'd like to help the channel grow, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. Thanks. Take care.